Hello, in today's video, I will be talking about post-operative checkup on patients with inguinal hernia. What is inguinal hernia? This occurs when tissue, such as part of the intestine, protrudes through a weak spot in the abdominal muscles, where the symptoms include pain or discomfort in the groin, especially when bending over, a bulge in the area of the pubic bone. We have a heavy or dragging sensation at the bulge area, also nausea, vomiting, and fever. Surgery is the only treatment so far to treat an inguinal hernia. Now, after surgery, what's next? It is the post-operative checkup on the patient. Immediately after surgery, the person is taken to the post-anesthesia care unit, also known as recovery room, where the patient is monitored closely. As a nurse, you should be responsible for some certain equipment for taking vital signs and a flow sheet for recording the vital signs. Good day, Mr. Jude. Congratulations, you had a very successful surgery, and all we have to work upon now is your recovery and ease you to the maximum comfort. Do you understand me? All right. So right now I will be assessing your health condition and I'll be taking your vital signs to make sure there is nothing wrong at all. Is that okay by you? Okay, let's start now. Before you start, make sure the patient looks very comfortable and your hands are washed and sanitized. So we start now. You put on your nose mask. My gloves tore at the very last minute, so I have to use my hands. So you begin to assess the patient's conditions. Does he look pale? Does he look normal? Is he all right? Does he look all right? Then we would start by checking the dressing. Is there blood on the dressing? Is there any stain? Does it needs to be redressed or redone again? Vital signs are taken frequently during the immediate post-op period because a change in vital signs could signal a complication of the surgery or the anesthesia. Vital signs are taken and recorded on the flow sheet. Now let's measure the temperature of the patient. Take the temperature usually every 15 minutes for the first hour, every 30 minutes for next 1 2 hours, every hour for the next 4 hours, and then every 4 hours. We should also measure the blood pressure of the patient. Take the pulse and respiration as well. Record all these into the flow sheet. The last temperature measured was 36.2 degrees Celsius. The blood pressure was 110/76 mmHg, and the beats per minute was 70, so it's all normal. Ask the patient if he or she is feeling pains each time you check the vital signs. Mr. Jude, do you feel pain anywhere? Are you alright? You should also check for physical signs such as change in level of responsiveness or difficulty in breathing. Assisted with positioning, most people will like to reposition themselves in few hours. For inguinal hernia, it's recommended to use the supine position and semi-Fowler's position. These are recommended positions. Also check for presence of drains and catheters, and if necessary, you should empty them. So, as a nurse, make sure your patient is stable and responding well to treatment. They could also need additional help after the checkup with illumination, hygiene, and nutrition. Thanks.